Hello, my name is Fennik Cerchio.
My name is Mason. I'm his boyfriend.
My name is Carla. I'm his mom.
For my informative speech, I have chosen the topic of medical procedures available for transgender people to reduce the symptoms of gender dysphoria. What gender dysphoria is, as defined by the American Psychiatric Association, is a disconnection or incongruence between the biological sex someone was assigned at birth and the gender identity they most associate themselves with. This disconnection can cause one to be uncomfortable or dissatisfied with the way their body looks. And to treat that aspect of gender dysphoria, there have been many developed medical procedures to affirm someone's gender identity and decrease the symptoms of gender dysphoria. And the ones I will be discussing today are hormone replacement therapy, also known as HRT, facial feminization surgery and facial masculinization surgery, and breast augmentation and double mastectomies, also referred to as top surgery. Hormone replacement therapy involves increasing the amount of desired hormones within an individual's body and reducing the amount of naturally occurring hormones. For transgender women, this involves taking estrogen-based medications and testosterone blockers, either as a pill, a gel, a patch, or an injection. And this treatment produces a more feminine body by redistributing fat to the hips, chest, thighs, and butt. It creates softer skin that is also less oily, thicker, fuller hair on the scalp, and reduced muscle mass. For transgender men, this involves taking testosterone-based medications, either as a topical gel or an injection. And the effects from the testosterone-based hormone replacement therapy are increased body hair or facial hair, fat redistribution to the abdomen, increased muscle mass and strength, and sometimes it can cause acne or balding. These, the effects of hormone replacement therapy create a more masculine or more feminine body for transgender individuals, reducing the physical discomfort that comes from the way one looks when experiencing gender dysphoria. Facial masculinization surgery and facial feminization surgery treat gender dysphoria in a similar way by changing the way the face looks to be more feminine or more masculine. For facial feminization surgery, this involves lifting the hairline and brows and eyelids to create a rounder, more feminine looking face, producing a smaller nose via a rhinoplasty, and reducing the appearance of the chin and jaw. For facial masculinization surgery, this involves enhancing the jaw and chin to be more angular, doing a brow lift to create more angular brows, and adjusting the shape of the nose via rhinoplasty to create a more masculine face overall. The last treatment I am going to discuss is breast augmentation, particularly for transgender women, and double mastectomies for transgender men. A breast augmentation creates a larger chest or breasts by introducing either artificial implants or fat from another part of the body extracted via liposuction. This method is called fat grafting. And among the two, it is the most unsuccessful treatment with a 40 to 50% rejection rate. But the implantations are typically successful. A double mastectomy, particularly used for trans men, reduces the size of the chest by removing excess skin, tissue, including the milk ducts, and changing the shape of the areola and nipple. Both procedures create more feminine or more masculine chests as the individual desires to create an overall more feminine or more masculine body shape and silhouette. This is a very effective method of treating gender dysphoria related to the physical appearance. We have discussed today gender dysphoria, what it is, and the effects it can have on a person. And the most common ways to treat gender dysphoria when it is related to the physical appearance. To recap, I have discussed hormone replacement therapy, facial feminization surgery and facial masculinization surgery, and breast augmentations and double mastectomies. All of these treatments, when coupled with personal discovery, can significantly reduce the uncomfortable psychological effects of gender dysphoria in transgender individuals.